So what other article do we have? We'll do another one. I got this one. Oh my God. Everybody, you need to smoke right now. Get your drink. Are you ready? Now, I
Yeah,
know
got my
you've been
smoke.
consuming cannabis for a long time. I've got some bad news to deliver to you all. Brace yourselves. A quarter of mental health cases are linked to cannabis. One whole quarter. How about that? How about that?
Now, I want to see how this data correlates in here. Now,
Oh
how do you
my
make a
gosh.
statement like this?
This is from the BBC, everybody. This is from
Oh,
the
yeah, that
BBC.
says it all, doesn't it?
So there
Yeah.
you go. Get your salt, add a pinch or two.
Yeah.
1 in 4 admissions to Guernsey's adult mental health ward in 2023 were likely to be linked to cannabis use, a state report has found. How about you start doing studies on other things, you used to pricks? This compares with 4% of cases in 2019 when medicinal cannabis prescriptions were introduced. The figures within the Mental Health Strategy annual report are based on clinical judgment. That means there could be other contributing factors, but doctors think it is more likely to be linked to cannabis than not. The report revealed that in 2023, of the admissions in Crevishon Ward, the inpatient mental health facility at Princess Elizabeth Hospital, 27 to 25% of total admissions were related to cannabis use. It added admissions associated to cannabis were not definitely and solely caused by its use, but given the degree of increase, the case for it being at least partially responsible is compelling. I don't know about that, man. I mean, what do you think about this?
Well,
Did,
again, it's blaming mental health, but it doesn't say, like, is it down to spice? What sort of cannabis? What are they classing as cannabis? Also, are a lot of these people being sent there because of court orders for pleading
Yeah, this is
guilty
what I was thinking as
and
well.
stuff like that? Yeah.
You've been smoking cannabis, so you need to go and do this. Because they do that sometimes. That's going to increase the amount of people going there for particular things. But then there's a lot of things that have taken place over the last few years that can cause people to have mental health problems like depression, anxiety, all of these different things. And maybe they're smoking cannabis too, but there's other things that could have triggered it in the first place. I think it's just ridiculous to jump to conclusions like that and say, "Oh, it must be the weed."
That's what I'm asking here. I'm trying to reread this as much as I can to be sure that I'm getting this here. They're not they're I don't understand where they're getting this number 27 to 25 of total admissions were related to cannabis use. In what way is my question? In what way? Did the respondents basically just say that they've used cannabis in the last year? Is that what they're using? Is it that
Well,
stupid?
maybe it's like sometimes you get young kids people who haven't experienced cannabis very much. They experiment with cannabis. It's a bit too strong. They go on the YT and they freak out a little bit. It could be a case of, and I'm not saying this is the case. I'm just saying it could be the case of there is a new procedure that if somebody has had too much cannabis, then they need to be referred to the psychological ward while they're freaking out. That could increase the amount of admissions in a certain hospital ward. There's so many things that need to be taken into consideration here. And to blame cannabis like this, I think it's just naive, man. They jump into conclusions, and maybe they're even just saying shit for fucking clickbait articles
Yeah,
nowadays.
well,
You know what I
it
mean?
also states there as well. The report notes that 94% of heavy cannabis users never experience psychosis.
So
Yeah,
Yeah,
so
I'll read a
yeah,
bit more of this. Yeah. So it says, it said this matches international experiences and was having an impact on individuals, carers, and the mental health service. The report notes 94% of heavy cannabis users, and that's heavy cannabis users as well, never experience psychosis. It's also noted referrals to the child and adolescent mental health services has increased by 14% from 585 referrals in 2022 to 684 referrals in 2023. It's not that much of an increase, really. I mean, it sounds crazy to say that, but because all increase is bad. But again, there's other factors being taken that they need to be taken into consideration here.
one factor they never consideration is more and more younger people have access to phones. So therefore, they have access to the internet. So therefore, they'll find that there are people out there that support them and going through the same shit, and they feel more confident in
Yeah,
coming forward because of this.
very
So
true.
it is, yeah. So that will be a thing, a factor as well. Because I've worked in the industry and was a child of fucking issues. So I
You
know
were
these.
you were a
That's
child
the
too?
facts.
I was a
Yeah,
child.
yeah. I
No,
was a
yeah,
child
I
too.
never was. I never was. What's
You never
pregnancy
were a
like?
child? Oh my
No,
God.
no.
But
Unlucky,
as a
right?
child, like, was quite extreme with mental health conditions as a kid as
Yeah.
well.
Yeah, man.
So we just have a few more things here. We have early intervention. Overall, the number of nights spent by patients on the Crevishon ward in 2023 was slightly lower than previous year, the reporter said. Again, this could be like overnight stays from when people have smoked too much cannabis, like I said, because they haven't, there might have been more patients, but they haven't stayed there for as long. Dr. Nicola Brink, Director of Public Health, said, I am really pleased with the progress made with the implementation of the mental health and well-being strategy since its launch in 2023. A whole island approach to mental health and well-being is key, and considering mental health and well-being in all policies will help address the social, economic, and environmental factors that impact people's mental health and well-being. Right? I don't know.
That was kind of a double talk, wasn't it?
Yeah, well, it usually is when you speak to folk like that, I think.
Poor ChatGPT editing for them. Yeah.
Joe Cottle, Chief Executive of Guernsey Mind, said, we are pleased that this report highlights the continued efforts across the charitable and voluntary sector, states of Guernsey and other partners to raise awareness of mental health and importance of prevention and early intervention. Yeah, and that we definitely want to raise awareness of these things. People need to be aware that their mental health is as important as their physical health. And if they're having problems, they need to speak to somebody about it. But you can't fucking find a scapegoat and try and blame everything on that and ignore major factors like the way the economy is running right now, the fact that there's multiple massive conflicts going on around the world that could escalate very easily. It's 2024 is a tough year. There's a lot going on, and that could also have an effect on people as well. So I think it's unfair to just assume that cannabis is the problem when there's more and more people using cannabis around the world, and we haven't seen a huge rise in psychological issues. Or maybe we have. I don't know. Well, I think you hit the nail on the head there, Billy. So if they're so bothered about young people's mental health, do something about social media, because that's the biggest problem. If you want to be taken seriously, tackle that first. You know what I mean?
Yeah, also I think they're like ignoring just loads of stuff as well. Like how many people who have prescribed medical cannabis have reported mental health to the mental health team? If you know what I mean? Yeah, I would like to know the exact numbers, because you'd have the exact numbers, because it'd all be on the medical record, wouldn't it? So you'd have an exact number. Out of 20,000 people who've been prescribed, how many out of that 20,000 have reported to the mental health?
And that's it. And if you say you have mental health problems, then you can get cannabis, legally on prescription. And Ben here in the chat said, I've been refused treatment by the mental health teams, partly due to telling them I used cannabis before it was legal. They still list me as a substance abuser because of alleged illegal use. Shocking, isn't it?
That's standard practice, Ben. That's why I've been refused help for my entire life for childhood trauma. But yet they don't care. You're a dirty cannabis user. So,
yeah, dirty druggy degenerate.
Yep.
Zero
help.
Billy's point about social media kind of reminds me of an article I was reading this morning in preparation for the show. It said that, you guys will appreciate this, that a majority of youth use Reddit as their source for information for cannabis.
No, it's all explained. Jesus.
Yeah, man. That's about the most toxic and horrible format that I know of.
Damn, that explains a lot.
That's the big problem, isn't it?
Going from TikTok to Reddit, it's like hot to cold, hot to cold, hot to cold. Dopamine, serotonin, dopamine. Damn.
If anybody's trying to get all your information about weed from Reddit, my God, you're going to be in trouble.
Wow.
There's so many wrong information. There's so much different information up there on Reddit. It's not a place to learn people, really. I'm sorry, but sorry, Reddit.
Just before we move off from this article here, we're going to the next one. But if you are suffering with any mental health issues, do find help and don't feel any shame in it. All right, because everybody has problems, man. So if you do feel like you need help, you need to talk to somebody, then go and find the help and talk to somebody. Don't be ashamed. Don't try and hold it all in. I know many of us blokes, and the ladies too, but specifically men, they can hide their feelings a bit too much and it become detrimental. Don't let that happen. Find help if you need it. And this is a good time to mention our sponsor, BetterHelp. It's not really. That's just one of the sponsors on all the podcasts right now. You know that one?
It was Manscaped. Yeah. My God,
what happened? Manscaped, Manscaped, man. Manscaped might help in this situation as well. You never know.
Look, when you trim the bush, it looks a bit bigger. That will definitely make you feel better, right?
There you go,
know what I mean?
Now and then.
It works in many different ways.